Medicare coverage for durable medical equipment. We wanted to make this video because a lot of people don't know what's covered and how it's covered. Durable medical equipment, or DME coverage. How often is it covered? Medicare Part B medical insurance covers medically necessary durable medical equipment that your doctor prescribes for use in your home. Only your doctor can prescribe medical equipment for you. DME meets these criteria. Durable, can withstand repeated use, used for a medical reason, not useful to someone who isn't sick or injured, used in your home, has an expected lifetime of at least 3 years. Payments for durable medical equipment, prosthetics, orthotics, and supplies made on behalf of beneficiaries in skilled nursing home facilities stays covered under Medicare Part A. That's from the Office of the Inspector General. DME that Medicare covers includes, but isn't limited to, air-fluidized beds and other support services. These supplies are only rented. Blood sugar monitors, blood sugar glucose test strips, canes, however white canes for the blind aren't covered. Commode chairs, continuous passive motion CPAP machine, crutches, hospital beds, infusion pumps and supplies when necessary to administer certain drugs, manual wheelchairs and power mobility devices, nebulizers and nebulizer medications, oxygen equipment and accessories, patient lifts, sleep apnea and continuous passive airway pressure CPAP devices and accessories, suction pumps, traction equipment, and walkers. So you can see it covers quite a bit of material. I personally used the CPAP machine for quite some years now when it was discovered that I was having major issues with migraine headaches because I had sleep apnea and was not aware of it. If you snore a lot or have those kind of issues, get a sleep test done and you'll find out if you also have sleep apnea. And under Medicare, you can get these devices at no cost. Who's eligible and costs? Who's eligible? All people with Part B are covered. Your costs in original Medicare. If your supplier accepts assignment, you pay 20% of the Medicare approved amount and the Part B deductible applies. Medicare pays for different kinds of DME in different ways depending on the type of equipment. You may need to rent the equipment. You may need to buy the equipment. You may be able to choose whether to rent or to buy the equipment depending on different situations. Medicare will only cover your DME if your doctor and DME suppliers are enrolled in Medicare. Doctors and suppliers have to meet strict standards to enroll and stay enrolled in Medicare. If your doctors or suppliers aren't enrolled, Medicare won't pay the claim submitted by them. It's also important to ask your suppliers if they participate in Medicare before you get DME. If suppliers are participating suppliers, they must accept assignment. If suppliers are enrolled in Medicare but aren't participating, they may choose not to accept assignment. If suppliers don't accept assignment, there's no limit on the amount they can charge you. So be careful. Be sure that your supplier is in Medicare. Competitive bidding program. If you live or visit certain areas, you may be affected by Medicare's competitive bidding program. In most cases, Medicare will only help pay for these equipment and supplies if they're provided by contract suppliers when both of these apply. 1. You have original Medicare. 2. You have competitive bid equipment and supplies in competitive bidding areas. Contract suppliers can't charge you more than the 20% insurance, co-insurance, and any unmet yearly deductible for any equipment or supplies included in the competitive bidding. So a word to the wise, make sure that the person you're getting your supply from is in the Medicare program and make sure that you get it in writing. Medicare Part B covers durable equipment. Items such as oxygen equipment and supplies, wheelchairs, walkers, and hospital beds for use in the home. Some items must be rented. You pay 20% of the Medicare approved amount and the Part B deductible applies. Other, including but not limited to, medically necessary medical supplies and services and supplies such as clinical laboratory services, diabetic supplies, kidney dialysis service and supplies, mental health care, limited outpatient prescription drugs. Yes, some forms of prescription drugs are covered by the Part B. Diagnostic x-rays, MRIs, CT scans, and EKGs, transplant and other services are covered. Costs vary, of course. So what is this saying? You pay your Part B Medicare deductible once a year, and then you pay 20% of the cost of that Medicare doesn't cover. Now, if you have a supplement plan or a Part D medical plan, that should cover you. If you're in a Medicare Advantage plan, that should cover you. So make sure you check it out before you buy anything. We have become affiliates of CSA Medical Supply and receive a commission on your purchase. This company ships all over the country bathroom safety equipment, braces and supports, hospital bed, medical supplies, mobility aids, wheelchairs, patient lifts, electrotherapy, a lot of equipment at good prices, and they do participate in the Medicare program. So anything you need, please contact us at shortmed.com. Send us an email. Please subscribe. Please forward this video and information to everyone that you know may be needed in need of these services. So again, we'll see you on the next video. Take a look at what CSA has to offer. See you on the next video. Bye-bye.